Secret Savings presented by Municipal Credit Union. We get New Yorkers more, so you can get more New York.
Well, between rising premiums, copays, and out-of-pocket costs, healthcare is getting harder and harder to afford for so many families.
The good news, there are ways to fight back. Smart shopping expert Trey Botch from TrueTrey.com is joining us this morning with her favorite strategies. Good morning to you, Trey. Always good to see you.
Good morning. Great to see you both.
All right, so healthcare costs, they keep climbing, but what is a very common mistake, and a costly one really, that people make?
Yeah, one is just to kind of set it and forget it, allow your plan to renew and roll over every year, especially with the changes that we've seen in the Affordable Care Act. You may have been receiving subsidies and now you're not. There may be a new plan available that you could look into. So before you allow your plan to roll over, that's typically in November, December, just make sure you've done your research and chosen the right plan for you right now.
Trey, what should people do if they find themselves between coverage or if their coverage isn't meeting their needs?
Yeah, this is such a good question because people are often underinsured. And so there are ways to supplement. People of all ages can sign up for a GoodRx Companion, which for $14.99 a month or $9.99 a month, $9.99 a month if you're paying annually, will give you access to over 200 common generic prescriptions for free, access to hundreds of others at under $10, access to savings on dental, eye care, virtual visits. So this is a really good way to supplement if your insurance is not making the grade right now.
Okay. Well, what about health savings accounts and flexible spending accounts? I think sometimes people forget they have that.
Yeah. That's true. And not every plan offers them, but you should definitely look at your plan to see if they have one, because what this means is that you can use pre-tax dollars to pay for things like that are medical related. And that could be even skincare, like sunscreen and other non-prescription medications. So these plans are really helpful. And the IRS just increased the amount that you can use of pre-tax dollars. So if you have this as a part of your plan, definitely take advantage of it.
You talked a little about GoodRx. Can you elaborate a little more on ways that consumers can save on prescriptions?
Yes, and so I've written an extensive blog post on this at TrueTrey.com, but there are some easy ways to save on prescriptions. GoodRx has a really good tool prescription prices. So I find that to be very, very helpful. Something else that I like to do personally is if there's a medication that I'm taking regularly, I sign up for 90 days instead of 30 days, and many doctors will allow this. And the price really goes down when you do that, and then you don't have to go to the pharmacy as often either. So I like that one.
Oh, that is good. That is really good. But what about where we choose to get our care? Is that really important?
It really is. And so, an in-office visit versus a telehealth visit, there's a very different cost there. The telehealth will always be less expensive. So try to opt for that if you can, if it's just a check-in with your doctor to look at some blood results, for example. And if you're really not feeling well, if you go to urgent care, an urgent care versus an ER, that's a very big difference in cost. And so think carefully about the kind of care that you're getting and where you get your care, and you can save a lot that way as well.
I do a lot of that telecare.
Yeah,
using the phone.
Exactly.
And there's also a lot of people who only go to the doctor when something is hurting. So let's talk about preventative care. How important is that?
So important. So if we're taking regular care of ourselves, if we're going to our annual visit, we're getting our blood drawn and looked at, you'll be in much better shape in case something is kind of brewing in your body versus waiting until it kind of hits you like a tidal wave and then you're in trouble. So preventative care is so important and a really, really good way to keep your healthcare costs down and also to feel well.
Yeah, you list some of the exams that we should really make sure we take. Bone density scans, mammograms.
And all these things, as you're getting older, there are a lot of these tests that you may not be aware of. If you're not seeing a primary caregiver, you're not learning about a bone density scan, for example, or that colonoscopy that you'd be getting. So that annual visit is really important.
Yeah, and don't wait to schedule it.
Right.
Exactly.
All right.
Be proactive. So where can our viewers learn more information about this, Trey?
Sure. So you can find me at TrueTrey.com or at TrueTrey on Instagram.
All right, Trey, you always have great advice. Love seeing you.
Great to see you guys. Thank you.
Thanks, Trey.